It is cold in this house. It is cold in this house. But then I thought about what the real song was.
Yeah.
Yeah.
That happened yesterday. We walked outside. I went somewhere and it was 34 degrees, and I knew it was going to change. So I didn't. I layered. I didn't do anything else. And then I came out of the place where I had to run errands. 60. I was like, this is how people catch walking pneumonia, as people say down here. This is how you get the. This is how you get the walking pneumonia.
Walking pneumonia, double pneumonia. Those are not official diagnoses. I need for some.
Wait, are they not?
No, and I need for people to stop saying walking and double pneumonia, just like I need for people to stop saying sugar diabetes. Like,
wait,
these are not.
Back up. Walking pneumonia is a thing because it's the pneumonia that you can, like, you don't have to be hospitalized for. Like, you got it still, but you can walk around with it.
You mean atypical pneumonia, but it's not walking. Like, I can't find a code to diagnoses for it to bill you. Like, that doesn't walking pneumonia.
It's not on you. It's not on your old tablet. You have walking.
It's not
pneumonia.
called walking pneumonia, and it's not called double pneumonia. If your symptoms are
because I got it in both lungs. I don't have it in one lung. I have it in the other lung. Double pneumonia.
Unilateral, bilateral. Like, let's stop talking this double. You know what?
1, 2, double. We're not wrong. We just might not have the jargon.
Right. It's so funny because when I'm talking to folk and I'm just like, well, what surgery did you have? Or, what was your diagnosis or what medicine? It is so painful to hear. Like, the biggest thing, I ask patients, what medicine are you taking? Oh, I'm taking something for my blood pressure.
Yeah.
It's the pink. It's the red. No.
You went to school for this.
No.
Technically you didn't.
but I did not go to pharmacy school, right? But I took pharmacology, but still, people need to know what they're taking. Know your medications, know your dosages. Don't just walk around and know what your diagnosis is. Stop talking about sugar diabetes and
listen about that whole medication dosage. Like, you got me on the name. I can tell you what the name of it is.
You know who knows medication? Is your oldest daughter.
Oh,
yeah.
Yeah, she does.
She knows
baby.
medication.
But she has to know. She has to, which is sad because we had a recent issue with her, and I got to the point now where we frequent medical places with her often because she has a chronic illness. It's not something we can fix.
Right.
And I'll get to the point where, because she has a myriad of things she has to take, I'll turn to her and be like, what is it? What's the name of it? How much do you have to do? And that chick will rattle that thing off at 11. Like, she's amazing. She's amazing at
it. That's how I want all patients to be. I don't know how it is to have a kid in the hospital.
It sucks. Listen, where do we start? So I can talk about this. So I had a few of them there. What? So let's go.
It's interesting because, number one, I don't have children. My husband and I.
You have nieces and nephews. Yes.
Yeah, I was gonna say we don't have
children. You are a legit auntie.
I'm a legit auntie on purpose.
Legit auntie.
But no matter who's in the hospital, I've been in medicine for a minute, and I've been practicing medicine 19 years now, 18 years, 19 years.
And look at you actually admit the real date.
But to be honest, it didn't matter. It doesn't matter how many people I take care of in the hospital, in the office, who I admit. When it happens to a relative, I will never forget. I was on call.
Yes.
Laboring patients when you went into labor.
Yes.
With your first child. And I promise you, I had chest pain thinking about yours. At the same time, I was distracted.
While you're delivering actual children and have no response to that whatsoever.
Yeah, I wasn't stressed out about them.
No.
So I remember when I got to the hospital and I went to visit, I was just like, oh my goodness. And I got there and I saw that you were fine. And I saw that little man was fine. And then I said, okay, well, I will relieve, I think it was mom and daddy up there. I will relieve you, PJ. I'll relieve you. I'll sit up here. And I think after 10 minutes, I was just like, I don't think I've been in a hospital room this long. Like, no. So,
oh my God.
We're supposed to look
no, you were there for a couple of hours. Because the thing was, I think you were relieving them so they could go eat or something. It was during the day.
It was during the day.
It was during the day, so you weren't trying to sleep there or whatever, because PJ was rocking the nights there, obviously. And so you decided that since it was time for everybody to go eat or whatever, and obviously they're catering to mom, new mom in the hospital, they're letting me eat, they're bringing me food, and so you're just like, I'll stay. And I was like, all right, cool. I mean, it was no big deal to me, but you were there for a few hours.
How is that, being in the hospital with a kid?
Let me tell you this: you don't sleep. I think the funniest statement that I got this past time was that a nurse kept, every time the nurses walked in, I was like dead looking at them like, hey, how you doing? I'm sure they swore that I was drinking coffee on the low, and I wasn't. It was just the adrenaline of like wanting to make sure that everything was going, everything was going well. And when they're coming in and giving medication and they're pushing stuff through the IV, like I want to be awake for all of that. And so the nurse came in and she was just like, oh, can't sleep. I was like, nah, sis, like this is me. You're getting all of this at 2 a.m. on this medicine run right here. Yeah. Like that. But it's nerve wracking because you find yourself, and this is me, I should say me. It's nerve wracking for me because I find myself, there's nothing you can do. I know that I have mentioned in past episodes and even some of the stuff that we have on all of our social media. Go follow us on our social media stuff. But even on social media stuff, there was this one story I told about like being a low key control freak. So to put me in a hospital where I can't do anything but just stare at the person.
That's it.
Listen,
That's it.
That and stare at them watching cartoons all day.
After
they're like stable. No. After they're stable. Well, you know, she even does it beforehand. Like we got to tell her to turn it off. Like
when she's in a crisis?
Give you this. You said what?
When she's in a crisis?
Yeah, no, she wants to watch TV.
Huh?
Listen, I don't judge her way of how to cope with the certain things that she's going through, but that is her, like, even when we were in the ER, she tried to turn on the television. And I was just like, can you wait until they like get this IV together?
Yeah.
Like, give it a minute.
So if you think about when you were in the hospital though, because see, I can only say on my side as a person who's coming in rounding, I'm in the room just long enough to talk to the patient, their patient's family, and then I'm out. Think about what you experienced with her or even yourself and what you see and what you creatives put on television. Like, is there much of a difference?
No, because see, here's the thing. Okay, so we have a see not say kind of a thing when you're looking at television, right? Like we have to show it. There's no way to depict an experience like this because number one, most of it is just you sitting. You're just sitting there, you know. Like we want to put the dramatics. Like if the nurse comes in, he's just like, "What are you giving my daughter?" Like that's what we.
Right.
Which never happens. Like that's never happened to me. I'm not saying that never happens. It just never happens to me.
Right.
Everybody's always really, really nice and very, very, very honest and open and about everything that they're doing. But that's what we put on TV. But the dead air, like literally that's all it is. It's just dead air if you're just sitting there. And what's sad is that I always know if we're about to have to spend some time in the hospital, if the crisis starts at home. So I go ahead and pack up the laptop, pack up the phone chargers, you know, something. I'd get her tablet or whatever, because I know we're about to do it for the long haul. But there's no way to like I can't even think of a movie or a TV show that depicts it correctly.
That depicts it what I've been saying all this time.
No, because it takes research. It's all it takes. Listen, I could a laundry list, okay, of shows or programs or television shows that depict it incorrectly, or even depict the crisis incorrectly.
Right.
But I can't think of a show where when usually when they're dealing with kids on TV, they really want you to feel for that kid and they want you to be like all sad for them. So it's like the most, depressing kind of, their last wish is to whatever. It's like that. But in situations like this where we know that there's another side, we just got to get there, but it's going to take us 6 days or it's going to take us 5 days. Like nobody really wants to watch that on TV because it'll just be you watching an empty room of me twiddling my thumbs or playing solitaire on my phone. Like
it's just flat out boring.
It's boring.
And
let me say to y'all, to the hospitals, just directly to the hospitals, I'm gonna need y'all to have better options for the people that are in the pediatric rooms. Can we do that? I am a whole adult, okay? And I'm gonna need not to have to go down 3 floors to the vending place. Like, have a vending machine on the floor, okay? Give me a menu with adult things on it. like tofu and pasta and salad.
You're doing the
most. Don't be giving me the chicken fingers and the grilled cheese menu and being like, and Miss Janita, you can actually order a meal off of this menu and it's covered by the hospital. Like what I'm gonna look like eating grilled cheese in the shape of dinosaurs? What is that?
I was gonna say you get peanut butter and jelly.
Like what am I doing with that? Like you can have anything you want for breakfast. I don't want a banana muffin. I would like some steel cut oats and a smoothie. Hello.
No, with coconut milk and a taste of hazelnut.
I mean, let's not even get started on the dry coffee y'all have at that plate. Like, we're not even gonna get started there. I just need. No, if we have to stay there because we can't leave our minors there. And I'm not saying that when I stay, because I know if I got to go to the hospital for something, you ain't got to cater like that to me. But if I'm a mama sitting in the hospital room, I don't want no lollipops. I don't want no popsicles. Okay, can I have some basil with some rotini and some roasted red peppers and tomatoes with a little bit of balsamic vinegar and olive oil? Like, can I get that?
They have that.
At whose hospital do they have that?
It's called Uber Eats. Get it, order it, have them deliver it. You meet them in the lobby and be done. Because that's how you're gonna. It's a hospital. It's not a restaurant. And that being said, it depends on the hospital. Because I've been to some hospitals where you walk in and they have, salmon on a plank and risotto, and you're just like, oh, okay, right.
Couscous, hummus, yes.
But they do have it. I mean, the hospital where you deliver, they had a straight Tim Hortons and.
Okay, but first of all, that hospital was bananas, but even the patient was getting that food. Like they had a restaurant that catered to the patients, but let's rephrase, to the women that have just given birth, because I had to have surgery at that same hospital, and they don't treat regular patients like that. They just like, do you want water or juice? Which one? Juice or water? Which one you want? Y'all need to build a hospital that would be like so bananas that would cater to the caregiver. What?
I think that's all well and good. And I think hospitals that get excited about this imaginary hospital that does not exist in your city. I'm sure it exists somewhere in the country. I mean, I just haven't been in it. And I've been in some, but the thing about it is, what do you want first? You want a hospital that's going to give phenomenal care for everybody walking in, or you want your basil? Phenomenal care.
They were already giving her phenomenal care. So why can't I have my basil too, is all I'm saying. Let me have both. Can I have both? Can I have my basil? Can I have my olive oil? Can I have my sourdough bread to dip in the herbs like in Italy? Can I have that? No,
Bravo.
what do I get? A Rice Krispie treat.
Have you ever had an experience that was just like, I can't believe? Matter of fact, you told me about one time in the ED. But it was something happening in the room next to you. It was just like a demon spawn kid or something.
I mean, which time?
Oh, it's more than one.
That happens too much. So we often find ourselves in the ER with her.
Mm-hmm.
And initially when we would go in the ER, and I should say this. Now, because of her condition, a lot of times they'll put her in like a separate bay because there's a lot that they have to do before they take her upstairs.
Mm-hmm.
But before, when they didn't really know, we would be in like these double bay. I don't know what y'all call them. I call them bays, but like these double bays where it's only separated by a curtain, which is stupid to me because I'm just like, if y'all are doing that for anonymity or whatever, or how you pronounce that word, I done already seen everybody. Like they peeking around the corner going, is it okay if we turn the TV on? Like we already know who everybody is. Either y'all gonna have separate rooms in the ER or you're not. Like, don't put a curtain up. What does the curtain gonna do?
Some hospitals have bays where they actually have walls. It's just y'all's. Go ahead.
The curtain does nothing, is what I am telling healthcare professionals.
We know.
It does zero for people staying anonymous. Nothing. So we go in. There was one particular time, I think I remember, the one more time we go in, and this little girl, for lack of a better example, was like straight up the kid from The Exorcist. Like the entire time she was screaming. And what it was that at first my mom heart was just like, oh my gosh, this little girl must be in absolute peril. Like somebody help this little girl. And then I discovered that the reason why she was screaming was because she wanted the remote to the television and they weren't going to give it to her because they were trying to talk to the doctor. Mm-hmm. So then when we came in with my daughter and they were trying to get her situated and they overheard my daughter say, can I watch TV? And I had already said to my baby, I was like, no, because I saw what was coming. I was like, you're going to wait. Here's my phone. Here's Netflix. Turn on whatever you watch on the Netflix.
Right.
So the mom of the other girl hands me the remote after pulling back the curtain. So now everybody knows everybody, right?
Wait.
Yeah.
Did you just tell me that you were involved in this whole thing?
No, I was not involved. I did not want the remote. Ladybug said, can I watch TV? I said no. The mom was like, rip curtain. It's okay. She can watch television, and hands me the remote. So I take the remote.
Did she know that she wasn't supposed to move that curtain?
Apparently not, because I saw her whole face and that little girl. So she gives us the remote. She snatches the curtain back. This hammer, I didn't see it, but I will testify in court that her head spun all the way around.
You know what?
It spun all the way around. And she goes into this screaming. She starts kicking people. Her mom, when the nurse was trying to come in, she was kicking at the nurse and she was screaming and like, I mean, she was out. It was out of control to the point where my daughter tried to hand me the remote back and was like, no, it's good. Like, she can have it back. Like she stopped mid-crisis and was like, no, go ahead and give sis this remote back. We and we tried. And what was sad was that in the pediatric ER, there's really only like 3. It's still on like the regular hospital network.
Right.
So there's really only like 3 channels for kids, and all the rest of them had on like it's either Nickelodeon, the Cartoon Network, and something else. Disney? Well, Nickelodeon had switched over to Nick at Night by that time, and something else had switched over to regular TV. So it was only the Cartoon Network was the only thing that the kids could watch. So it wasn't like she was missing like Care Bear Countdown on the Disney Channel. Like that wasn't happening. She was livid, and so people, because that was going on, and because Ladybug was so like docile and like
Mhm.
sweet and would say thank you even in her crisis, we started getting like the little girl perks. Like they were bringing her popsicles, coloring books. The child care team that they have to help kids cope was like giving her tablets to play with because she was so
Mhm.
nice. I was so thankful when we got upstairs we had a private room, which is actually that is normal in the hospital here in this city. Like you're gonna get a private room, but I was
Yeah.
so grateful for that because I was just like, if these jokers got to be roommates for the rest of the time. And it turned out they ended up discharging her because they had, and the only reason why I know that is because they had to start an IV on Ladybug. They ended up discharging this little girl because all the mama brought her in was because she was constipated. That's it.
So see, this is when you don't use the emergency room in place of, your regular doctor urgent care. Like it's not the same thing. Clearly her constipation was not affecting any
I
other part
feel
of
like
her.
if
Like,
they let her scream like she did a few more times over a toilet, she probably would have solved the
you know what?
constipation problem because
You
she
know
was out of line. There was another time where, again, the false anonymous curtain, there was this little boy where they couldn't get him to stay in the bed.
Mm-hmm.
So he just kept running around. At one point, he ran on our side. He was cute, but he wasn't still.
Was he there for an infectious?
I don't know.
Oh, that's just nasty.
Well, I will say this. I think this ER is very good about knowing who to put where.
Separating, yeah.
Yeah. Because even by the time, because again, you and I both know, my daughter is not a fan of needles. And in the early stages of the condition that she has, when she has to get an immediate shot when she gets there, and she let the whole ER know. We usually get a private bay. when she goes.
She and I are related. So when she gets older, she won't do those disrespectful screams, but she will look at the person who's about to take her blood and say, first of all, you get one try. You get punched in the throat, and it better be a butterfly needle.
She's better now, but
Yeah.
she almost cleared out a whole ER when she had to get an epinephrine shot once, and it was bad. And so I laughed the next time we were there. They were just like, so we're just gonna put her in here, and I'm just like, oh, the door's closing here. The door is actually closed in this room. Oh, okay, all right then.
Oh no, they have her chart flagged. There's an alert that as soon as they put her in the system, it's like a dang, dang, dang.
Which is so, it's funny and it kind of breaks your heart a little bit because that's literally what happened this past time is that when they put her name in the chart, all of a sudden it's almost like doctors came down on ropes. It's just like, Ladybug's here. Like, where did y'all come from? And then we were back in the back. It was almost red carpet-esque like for her. But yeah, you're right. No, that they know when they see that name come up on that computer screen, they're like, oh, she's here.
There's something that they have at the hospitals that, I personally am not a fan of, but I recognize that it can be done in a very responsible way and is very helpful to a lot of people.
Yeah.
And that's the therapy dogs.
The therapy dogs.
Wow. The syrupy sweetness that just came out of your face.
Listen. So she's always had the therapy dog when they go. And the therapy dog is so great because I guess the hospital, you don't think about it for kids. It can be overwhelming, especially when they got to get stuck and they got to go get x-rayed and all that good stuff. And so they have this child care team that they train these dogs. They're almost like, what do you call them? Service animals?
Yeah. Therapy dogs,
They're like service dogs. And they'll come in, and if your kid is a fan of dogs, so they ask before we ever see the dog. Like they'll come in and be like, "Would you like a visit from Oli Oli On today or whatever the kid dog's name is, whatever."
What a name.
Whatever. And and so they come in and they put like all of this stuff on the bed on top of the bed that the kid is actually in. And then they train the dog. The dog will come in and they'll pat the bed, and the dog hops up on the bed and just snuggles with the kid. That's literally it. And they stay for Ladybug, they stay with her usually about 20 minutes. And it is amazing
Oh,
to
that's
see,
a
like,
long
especially if,
time.
yeah, no, they're in there. So this last therapy dog we had was Orbit,
Mm-hmm.
who actually was like born into a litter of therapy dogs. And
Oh,
all of the dogs are named after space stuff because we live in the
aw.
Rocket City. And so Orbit came in, and beautiful golden retriever. I mean they take good care of these dogs, and very, very smart, very well trained. He hopped up on the bed
Mm-hmm.
and he just
Oh,
sat there. Yeah, and she pet him, and they had a great time. She was there for about 20. The lady that trains, and what it is that they have children's. They're kind of like social workers that sole purpose is to walk around with these animals. From what I hear, the
mm.
hospital where we were, they also have a therapy pony. I haven't seen the pony
Let me
yet.
tell you something. If I go to any hospital, I see a dang blasted horse, I'm gonna have some problems. If I see a dang blasted horse, I'm gonna have some problems.
Oh my
You know
god!
what? If you find out about the little pony, don't tell me because I'm still trying to get past these little therapy animals.
The
But
therapy animals work though. The therapy animal
yeah,
and and they're very. I mean, everything is very clean. It's not like they're hopping up on you and licking all you. They don't do any of that. They're very. They just sit there and they like being petted.
yeah.
And that's it. That's literally all they do. They don't perform tricks. They just chill next to the patient for a lot of time that we have them there, and then they leave.
Yeah, I don't think people think about like you said, you don't know how it is for kids, how stressful. I have not had to stay overnight at a hospital as a patient. I have, being on call. And I know there were times when I would do, 36 hours in the hospital and I would get to that, I don't
Mm.
know, 30th hour. And literally, sometimes I would literally just have to walk outside 2 steps out of the door just to stand
Mm-hmm.
to get a breath of it was just it is cabin fever at its best. So to hear that they have the doggies and they have like toys and stuff, I'm
They
assuming,
have
and
toys. They have tablets. They have
tablets.
yeah. They come in with these iPads that are inside like these cases that have nothing but like interactive games on them. Especially if the kid is having to go through a procedure.
Yeah.
Um, there's a game that Lena loves, and they asked. What I like about it is that they asked the parent, like, would you like the child care team to come in and whatever, and
Right.
you say yes, and then they come in, they just show up. They're to me, they're like the superheroes of the situation. So you have the nurses that are having to do all of the hard work, like the IVs and things of that nature, and then the child healthcare professional or the child professional. I forget what they call them, but they come in and they're basically like they're like the rodeo clowns of the hospital. So in the rodeo, if you have a bull that's running around and the bullfighter like loses his step or he gets hit or whatever, they send out this rodeo clown to distract the bull and
Right.
like run in front of the bull and make the bull come at them so that they can get the other guy to do whatever they got to do. And that's essentially what these people do. They distract the kid. Sometimes it works. Yeah, I think unfortunately for Ladybug, she's been so many times she recognizes when they're trying to distract her.
She's like, don't bring that rodeo clown in here.
She all of a sudden she's very alert. Like, wait a minute, there's too many people in this room. I don't want to
Yeah.
see your iPad.
Yeah.
But she has a harder time. She's good maybe like the first night or so, but when that IV has been in for like day 5,
I think,
and
honestly,
thankfully that's when the therapy dog shows up.
I think that's any adult, any person who's been in there and it's just like, this is getting really old. I know that I try to, if I'm telling somebody, if it's like a planned admission into the hospital, I'm just like, make sure that you have a family member there or a support person, someone, a second pair of ears, somebody that can take notes. Those are some of the things that I say. But, again, I'm just saying from my perspective. I'm curious as if you would say something different or what advice you would have for, well, other than
Listen,
don't have kids that are going to be in the hospital, but I
I
mean,
mean,
you
you
could
know, it's
come
so funny.
on
It's a
or
it's a
dad.
crapshoot. Like you can't, and even with what we're dealing with, which I mean, I can't even. Which is so funny because people be like, they're being so vague. It's not even that. Like I don't even mind telling people what she has. It's the explanation behind it. That's like
Right,
another 40 minutes. That's
right.
not even like
You say, and they'll be like, "What's that?"
Right. It's just
You
like,
mean she's what?
if you,
What?
but like, and then you'll be Googling and you'll end up down this rabbit hole like I usually am when I start Googling stuff. And so I end up calling, I end up calling Gina.
Yes.
Like, please explain this to me, because as far as I'm concerned, she's got 48 hours to live. No, the advice I would give is something that you forced me to do.
Oh.
Is know the history. So one of the biggest compliments I always get whenever the doctor comes in, they're just like, so tell us what's going on, right? And you taught me that they are not necessarily trying to hear your life story. Like,
No.
they don't want. They need bullet points that led up to the problem that you're having now. And I can say that there are times when I'll call you and I'll be like, so Monday I had fries, and then I begin thinking like, how did we get to this point? What is how did we get to this point? And you did that so much, and you were always adamant about me knowing the history of stuff, so that by the time a doc walks in the room, especially in the ER or hospital, especially when it comes to her, they'll be like, tell us what happened. I'm just like, at 9:15 this happened, at 10:25 this happened, at blah 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 this happened. This is when we showed up to the ER. This is when we're here. And the biggest compliment I get every time, especially this last time, they're just like, you give such a thorough history. And I think what happens is that people get upset about having to tell the story over and over again, because that used to be me. Like, how many times I got to tell y'all? I just told the lady that asked me a few minutes, not realizing that everybody needs to hear it in order for them to be able to be effective and begin to apply what is necessary for you or whomever to get out of there. So I think that would be it. Just kind of, if you find yourself, kind of take a moment and be like, okay, how did we get here? Why did I end up at this moment? I ended up at this moment because of a series of these events happening.
Yes. Don't say, well, it's in my chart. Let me tell you something. If it's an emergency and we need to know exactly why you're here right now, what we don't have time to do,
listen,
do it. But what we don't,
I can attest to that, because even though things are electronic, I can guarantee you, if they put Ladybug's chart on paper, that joint would be several folders. It would legit look like that. I mean, and that would be just from the last 2 years. That ain't even covered. And that would just be off of one diagnosis. and that ain't even not some of the other stuff she got to deal with. Like, it is not. But here, I had to learn that, because I was that person. I was just like, we wrote it down. Like, we wrote it down. And it wasn't until I was like, oh no, y'all need to know right now, so that nobody's right now while you're here doing like this.
So in 1926,
right?
Like, yeah, no, they don't.
You don't need that. Ain't no television show for that. Like, don't nobody want to watch that.
No. What was this episode about? Like, what was the episode about?
I don't know. We actually, we were talking about medication and ended up on this. So now we need an actual seed of substance, because I gave advice. We need an actual seed of substance.
Seed of substance. Don't tell me if there's a horse in the hospital.
Everything we talked about today, and it's not a horse, it's a pony.
The seed of substance is going to be, if you have to go to the hospital, know your story.
Know your story. Yes.
And the Academy Award goes to
Know Your Story. That's true.
Know your story.
Know your story. Know your summary, because we don't want to hear the whole story. Just know the summary.
Yes. Know the story for that day.
Know the plot points for that day. Is what we want. Exactly. Know your bullet points.
I do have to say that I'm feeling the periwinkle.
Okay. If that's the color we're going to call it, that's fine. I picked it because I thought it was a different shade of blue. But there we go.
It is. Blue. And where's the water?
Blue like water, which is what we're about to get.
Blue like water. How come I'm only the person who has the water in their hand when we say it's time to get the water? You don't ever have water in your hand? Are you drinking water?
Because I always thought the water was a non-literal. I'll go get water next time.
Whatever.
Bye, girl.
Bye, girl. I think it's interesting to see that you have such a wide range of music. Like you will do Whitney Houston, you will do trap music, like you. That's phenomenal.
Listen, let me tell you something. If anybody opened up my iTunes right now and just hit shuffle and let it play in their ear, they would be utterly confused.